Hello, welcome to this intro video of the CareerWize general surgery coding, scenario codings. Today we are going to code from general surgery number 8 from the CareerWize virtual internship. I have as a patient's name, Diane Whitley, and age is 53. She's female. Date of service is 15 of August 2022. The preoperative diagnosis is C, acute appendicitis. The postoperative diagnosis is perforated acute appendicitis. The procedure performed is the laparoscopy conversion to open appendectomy. General anesthesia is general. Pathology is the appendix and the blood loss of approximately 50 mL. In the operative reports and findings, we have that the patient was taken to the operative suite and placed in the supine position. A timeout was done in the room after the patient was given a general endotracheal anesthesia. Our abdomen was prepped with colexidine, prepped, and a Foley was placed. Once completed, a 5 millimeter optive view port was placed just below the umbilicus. Another port of 12 mm was placed in the lateral abdomen. She had some adhesion due to an old C-section that was performed. Some of these adhesions were taken down. The 5 millimeter port was placed in just suprapubically. The appendix was identified. The tip of it was quite friable. During the procedure of holding the appendix, the tip of it was perforated and there was little bit of spillage. Attempts were made to find the base of the cecum. The patient is quite heavy set, which made it more difficult. It was felt after several attempts of finding the base, it would better just to open the patient up, and this was what was done. The gas was inflated from the abdomen. A right paramedian incision was made. The muscles were split, the length of its fibers. The peritoneum was identified, grabs, and then the abdomen was then opened. Appendix and the cecum were readily apparent. The small bowel was packed out of the position. A right angle was used in order to gain access to the base of the appendix. A GIA stapler was brought across the base of the appendix. The right angle was then used to grab the mesoappendix. And the GIA stapler was brought across the base of the appendix as well. The appendix was removed. The abdomen was then irrigated. No bleeding was encountered in the mesoappendix or the appendiceal stem. Once completed, a drain was placed through the 5 millimeter suprapubic port sites. The drain was placed in the pelvis and along the right quarter. Once completed, an irrigation was completed. The deep peritoneum was closed with a 0 ficrule. The fascia itself was then reapproximated with 1 ficrule. Suture in an interrupted fashion. The skin was closed with staples and the penrose drain was sutured into position with nylon 2. The remaining incision was closed with staples. The patient was taken to the post-anesthesia recovery in satisfactory condition. The Foley will be left in and then removed tomorrow. From this report, we have as a preoperative diagnosed to be acute appendicitis. And after the procedure was done, the surgeon now documented it to be a perforated acute appendicitis. And the procedure done is the laparoscopy conversion to open appendectomy. So you have to write down our diagnosis to be able to know what to code. We will go for the post-operative diagnosis because it's the most definite diagnosis in this procedure, because this was done after this diagnosis was then given after the surgery was done. So we go for perforated acute appendicitis. Then also the procedure done here is the laparoscopy conversion to open appendectomy. If we can read through the reports, we find out that first the surgeon wanted to use a laparoscopic method to remove the appendix, but due to some problems he encountered along the way, the procedure had to be changed to an open procedure. So there's an ICD code for this, for failed laparoscopy, which we need to identify while we're coding. So you have to indicate that down, failed laparoscopy. Then also the main procedure that was done is the appendectomy, which is the removal of the appendix, which was done successfully. So now go over to code this procedure. We have to code our, from the ICD-10 index, if we search for appendicitis, which is our main term, we have the appendicitis. And we are looking for perforated appendicitis, and it's going to be acute. This is appendicitis unspecified. Let's open this and say, have with gangrene, have perforation, have peritoneal abscess, and also we have peritonitis. But this was just with perforation. Okay, in the code description, we have acute appendicitis with perforation and peritonitis without abscesses. Yes, this is very true. There was a perforation, and it's an acute appendicitis. So, okay, reading through the common language description, we see acute appendicitis progress from inflammation of the appendix, then gangrene followed by perforation. And now say that this is the code the right code we should be, or we are going to use for this diagnosis, K35.82, acute appendicitis with perforation and localized peritonitis without abscesses. Right. Write that down, K35.82. Then over to default laparoscopy position. Like I said earlier, that there is an ICD-10 CM code that identify this diagnosis or these reports, as you may call it. If you look for procedure, have surgical procedure, we have it was a conversion from a laparoscopic procedure to an open procedure. So let's open converted procedures. We have here laparoscopic to open. All right, we have here laparoscopy surgical procedure converted to an open procedure. That's a code to identify that it was a failed laparoscopic attempt, which was later changed to an opened procedure. We have Z53.81. And also coding for the procedure that was done. Right, waiting from the CPT index. Let's check appendectomy. All right, we don't have appendectomy, but we do have appendix, which is the body parts. We know searching from the CPT index, either you can choose from the procedure that was done or you can choose from the body parts. So here we have the body part to be the appendix, and we have removal, which is appendectomy, as removal of the appendix. Let's open this code and see, have a appendectomy alone when done. And going further, open the CPT guidelines. We have here for indicated for purpose of other major procedures. And also we have also a code for if the appendix was ruptured, but from our report, we see that the appendix was not a ruptured appendix, but rather it was just a perforated appendix. So we can't choose this, and this should be the code we will use, the 44950. 44950. So, okay, so going over to our CareerWize platform to input this and see. Right. We have as our first diagnosis code to be K35.32. And also we have C53.31. C53.31. Right. Our procedural code to be 44950. No modifier add. We link all these codes together. From our results here, we see that we were able to get our diagnosis correct, and the principal diagnostic code was well selected, and also our CPT code was also correct. All right, so those are the codes for this particular procedure. You also have to note that while coding from the general surgery, careful reading of the operative report is as much important, because you can't only rely on the summary that is being given by the surgeon, but you have to read through the report to understand what was exactly done. Because most of the times there are some procedures that may have been included there, but that was not identified on the summary. So as a coder, you have to take time to read it. Thank you for watching these videos, and I hope you have learned from this.